This is all an all-male panel. We've had to get one in before the end of the day. This is the one. For me, a journalist, it is nice to be at an event that is not about Brexit, but I gather you've had quite a bit of Brexit as well today, and I dare say we may get into it again. I'm going to use my chairman's prerogative. I'm going to abuse my chairman's prerogative to say a few words, just listening to the last panel, as a journalist, about why the media is not interested in what you're talking about today. So I'm going to give you about, I've just jotted down about 6 or 7 reasons, and I'm going to run through them very quickly because I think you'll find it interesting. Number one is chicken or egg problem. If our journalists, our political journalists, were out there talking to policymakers and politicians and were being briefed on this and there was excited chatter about it, it would feed back. But of course, they don't brief the journalists on it because the journalists are not covering it. So they're the chicken, we're the egg, and of course, neither side is talking about it. Each, in a way, is waiting for the other. So that is a sort of systemic dysfunction. The second is, I think, people outside these august forums probably take it much more for granted than you do. They would say, only an economist is kind of baffled as to why we talk about crime or health or life expectancy or the number of nurses we employ or poverty or jobs, and say, why are we not talking about things that matter to people? They would say we are talking about those things, and mostly those things are things that matter to people. To put it in other ways, what do you get about, what benefit is there, I think people would say, journalists would say, to talking about crime reduction or increase in a well-being context as opposed to just talking about it as crime? I mean, what extra buzz do you get from kind of building it into this framework? So that's my second one, taking it for granted. My third is skepticism. As soon as a politician says, I want to change the metric, immediately you say, is that because you failed on the one that you had before? And then there's another form of skepticism, skepticism part B, which is even if the intention is good and one felt that the politicians were kind of genuine about trying to move towards well-being, I think you will find a degree of skepticism that on the things that we're not talking about that matter to well-being, it's quite difficult for politicians to move the dial. So they may want to talk about it, but there's a good chance that they won't actually make much difference. My fifth point, or is it my sixth or my fourth? I can't remember. My fifth is journalists like discussions that have an edge. We on my program like to have an argument. I'm actually the one who's associated with trying to reduce the argument quotient on our program, and I annoy my producers by saying to guests who've been employed directly to have an argument, let's see if we can get you to agree on this point or that point. And that's considered kind of bad form in a television studio, trying to get people to agree. There isn't really much edge in the subject area you're talking about here. In as far as there's a disagreement, the disagreement is people like yourselves who care a lot about it and a lot of other people who don't care and are just indifferent about it, you know. And that doesn't make for interesting television. So there's a sort of edge problem. It might be that when you produce international league tables that can show a country sliding down or moving up, then you've got some edge, and then people will take an interest, because then we can have a national panic about what are we doing, slipping down this national league table, like every country does every 3 years with the PISA tables, which have done so much for bringing education policy to the floor. The final one I would say is this is sort of in the category of it's very difficult to point a camera at well-being. Now, you don't understand this, but one of the difficulties for television producers and television media is you do actually have to point a camera at something for the entire duration of a broadcast. And it is surprisingly easy to turn a camera on something that says crime, or jails, or nurses and doctors, or schools, or old people. It's very difficult to turn one on that sort of just says well-being, subjective, objective, composite measure, or any of those other things. This is, to most people, quite abstract. Crime, litter, these things are not abstract, so don't be surprised if the popular media tend to focus on the non-abstract. All of that being said, when you get some policies that are kind of interestingly different to the policies that you already would have on things like crime and poverty reduction. When you've got some policies, then we will have something to point the camera at, come back and let us know, and then media, I dare say, will take an interest. But that, I think, is a sort of summary of where the media are on it. I am a great supporter, by the way, of the kind of well-being agenda. And I went to Denmark and I did a piece on why Denmark is the happiest country in Europe. And that was in the year 2000. So that was some sort of ahead of my time. And I even won an award for that piece. And no one's ever mentioned it since. It's never had any. Right. Now, one of our panel, sorry, I'm really going on here. One of our panel in a previous event said, there is not an institution that wouldn't be run differently from prisons on when these well-being principles are taken into account. So our goal to motivate and invigorate and animate this debate is to come up with practical things. And that was John on our panel. I think it's true. So we will spread widely this afternoon. What I'm going to do is give them each a couple of minutes, up to 4 minutes each, rather shorter than the last panel, to say a few words by way of introduction, and then we'll have discussion up here, and I'll open to the floor. I have a number of issues which I thought were particularly interesting on skim reading the book and listening to the proceedings of the previous session, and I might push the panel on these, but I will see where the conversation goes. One, social comparison. How do you build that into policy? So I think you've heard this quote from the book. Extra education raises the happiness of the educated person somewhat over their whole lifetime, but it lowers the happiness of the rest of the population by at least as much. Now, if we really believe that there is this thing called envy or jealousy, what do we do and how does policy incorporate that? Is there good happiness and bad happiness? My good happiness is from me being better, and my bad happiness is my happiness at your complete failure. I don't know. That's an interesting area. The second is effectiveness of policy, because I think we will, in the end, recognize that there are a lot of things that are interesting to well-being, but the question is, are we effective at moving them? So that's the second. And the third, maybe we'll try and get back to this before the end, the left-right debate. You know, some of us have been brought up, really, on the great schism being left versus right in various aspects. And probably some of us had come to the view the left are kind of right on social policy, the right are kind of right on economics. That's the kind of the synthesis. So free markets, probably okay with a little bit of tempering. You know, liberal social values, probably good, generally good. Do we need to flip that round as a result of this? Certainly you can see left-wing economics resuscitated by the happiness and well-being agenda. There's a case for more progressive taxation. There's a case potentially for more intervention economically. But is there a case for more social conservatism? Is it family values that are the things that come out of the book and the literature and the debate now occurring? So those are some of my questions, but I'm going to let the panel speak. Let me briefly introduce them. David Halpern, you probably all know them all, UK Behavioural Insights team. He was the founding director of the Institute for Government as well, chief analyst at the Strategy Office, Prime Minister's Strategy Unit under Tony Blair, and has written many books in this area. John Helliwell is next to David from the University of British Columbia, Senior Fellow of the Canadian Institute for Advanced Research, and co-director of their program on social interactions, identity and well-being. Girol Karacaoglu is head of the School of Government in Victoria Business School at the University of Wellington, but importantly for us was formerly the chief economist at the New Zealand Treasury and has written on this while there. Interesting papers with titles like Alcoholism and Monetary Policy. And we all know what he means. And Mark Pearson at the end. Mark is Deputy Director of Employment, Labour and Social Affairs at the OECD, had worked on health division there, and Mark started life at the Institute for Fiscal Studies here in London. So we'll take a few minutes each. David.
Thank you. It's great to be here. So I thought just a quick couple of remarks. I mean, one thing is just to cast our mind back to attempts to do it. Of course, I see Nick in the corner. A generation ago, almost more than at the PMSU, we did do a paper on life satisfaction and attracted some interest, but nothing much happened in the policy world. But In 2010, with David Cameron, there was a significant push in this direction. Of course, Gus sat there with the PM, and I saw Jill over there. Yeah. So we would do three things. One was get going on the measurement, which I think we did pretty well on, thanks to Jill and others. Change how we thought about policy, so in relation to the Green Book, rewriting it, which Gus took some pretty rough meetings on to make sure it has happened, and did happen. But the area where we really made much less progress was it would actually change policy. And I think one of the reasons why, I think you can additionally say in Oliver's remarks, why it doesn't move forward faster, is because policymakers just aren't actually sure if they can do anything about it. And they're not clear, well, what would be a specific choice that would be different. Actually, I myself think there are lots of things which are quite a bit different. In the Legatum reports, which Gus chaired, quite a few of them are listed down, but let me just pick out a few of them to make it a bit more concrete. Some there are just existing things you would do, like in unemployment, you should worry more about, etc. There are certainly lots of areas of marginal judgment where it might make a difference. So, for example, within a given domain, like in criminal justice, you've got to decide where to deploy your resources. There are serious work to work out. Well, what are the kind of subjective impacts of different kinds of crime, where you would say, actually, particularly crimes against a person, matter more than crimes against, like, how would you work that out? It's hard to see doing that without some kind of subjective well-being engine behind it in some way. There are also domain-specific areas where, if this underlying discrepancy is between kind of a lot of our practice, in my view, partly based on a kind of naive model of human behavior, as it happens, and what we're actually doing, the reality in that kind of practice, you do see it breaking through in specific domain areas. So, a good example is in healthcare, where you want to get out of the hospital alive, hopefully. But actually, it matters greatly to people being treated with respect and dignity, right? And that's not captured in a simple measure. Where it does start to get captured when you ask people about, would you recommend this service to friends and family, which we have been introducing in recent years. So domain-specific satisfaction measures are actually quite a powerful route to introduce this sort of wider concept. But in terms of head-on, what are the kind of things you might do differently? Well, of course, Richard and others have championed absolutely mental health as a big area, which we think would go much further on, and also going upstream in terms of resilience and those kind of skills and capabilities in schools. And I would say, actually, not only in the UK, but quite a few countries are thinking about that quite seriously now, about how would you measure and build those kind of capacities earlier in life. And if you look at a lot of, essentially, cognitive behavioural therapies, they are actually a sort of form of learning about thinking. Why wait till someone's got a problem to introduce that? Community. I mean, one of the key areas where you surely see this is that the well-being literature takes you to say we underestimate systematically the importance of relationships and community. You touched on that, Evan, in your comments. And that does go to some quite specific policy. An example would be things like National Citizen Service, that you should have this experience, or in general, just trying to weight it in a more important way. A key point that also illustrates, one of the arguments in NCS is we're trying to introduce National Citizen Service, actual evaluations in terms of life satisfaction and indeed the 4 ONS measures. And it does indeed move the dial, so that's absolutely fascinating. It goes to issues of governance, of course we touched on. And the last one maybe, in the words of the coalition agreement, there was this interesting phrase about support people to make better choices for themselves. And one of the fascinating things, that's a horrible phrase and Gus always tells me not to use it, is deshrouding, is to actually reveal to people, not using this kind of data which we now have, well, what is the impact on your well-being of making these choices? In fact, you can even conceive it as one of the ways you recalibrate markets is to make consumers more sophisticated consumers in their choices. There's really a radical intervention in markets. But just to conclude, like one of the things that was really picked up, I noticed, from the ONS data was just publishing the data for different occupations, not just of earnings, but life satisfaction. Like, if you reveal that to young people, at the margins, they may make different choices. And that's really quite a big game changer in terms of how a market might operate, or indeed the choices that individuals make, either at an individual level or indeed at a collective level. So, I think some specifics.
Just explain that last thing again. What are you doing? You're showing...
On this one, it's actually just publishing the data. So you can see, for example, that lawyers earn more than medics, but medics have higher life satisfaction. That should be a relevant variable, but it was kind of it was concealed before.
Right.
If you reveal that, and if you reveal that in many other areas, in principle, people will actually make different choices in life.
Right. Sorry, I've got it. David, just a quick one. I mean, one of the things is, so let's suppose you take crime. you say we want to improve subjective measurements of subjective well-being with our crime policy. And let's take an example, because what you can end up doing is, in a way, taking ineffective policies that have a sort of irrational appeal, inverted commas. So let's suppose if you put lots of policemen on the beat so they're patrolling around, and let's suppose all the evidence is that this is useless when it comes to reducing crime, but people kind of like it. What should we do? Should we explain to people this is useless in terms of reducing crime? Do you really want to do it? Do you want us to do it? Or should you say, well, if it improves people's sense of well-being, even though it's not reducing crime, should you put the police on the beat?
Indeed. By the way, in terms of the empirical proposition, it may not be true, in as far as there's some evidence sometimes you put more police out, it makes people more concerned because they think, God, it must be unsafe around here. In fact, specifically, sirens have this effect in a demonstrable way. But you're right. In principle, you're introducing a secondary axis. So be it in relation to policing, do you want the comfort and the security, by the way, that might not be insignificant in relation to social trust if you feel more comfortable going out and so on, or did you want the hard measure? The same would be true in healthcare. Do you want to get out of a hospital, alive? Of course you do, but you also want to be treated with respect and dignity. So at least introduces a secondary dimension, and the modest interpretation of that would be within a given margin of that output, reducing crime or getting better health outcomes, can you also have people treated with respect and dignity or make people feel more comfortable, right? So those margins aren't to be sniffed at if it leads to, well, you have many, many ways you can implement a given policy. Can you get both the hard outcome and the so-called softer outcome, right? A more radical form, of course, say, actually, we're going to prioritize the secondary axis, but you don't have to go that step and still be having quite big impacts on policy.
Right, John, I'm not going to pick you next because I know you've got a couple of specifics, and I'm going to come to you last. So Girol.
Thank you. Thank you for making us part of this conversation. The topic is brilliant because over my 5 years at the New Zealand Treasury, we moved from a world where the focus of policy was maximizing economic growth per head of population, which is the first seminar I attended 5 years ago, to now my ex-chief executive publicly saying the purpose of public policy is to enhance intergenerational well-being. And our long-term fiscal statement, so-called, which is a document we need to publish once every 4 years, looking 40 years ahead to highlight the main economic, environmental, and social issues in New Zealand. The full first chapter is about intergenerational well-being and the absolute necessity of having an integrated environmental, economic, and social policy framework to address it. We frame it by saying that the purpose of public policy, given that everyone within their constraint are trying to improve their lives as they want to live it, the purpose of public policy is then to simply help them to achieve that. And in order to do that, we focus on capabilities and opportunities. The framework we use is that of Kenneth Arrow and Dasgupta and all that, where they say the objective of public policy is intergenerational well-being. That in turn is a function of comprehensive consumption. Think of the 11 domains of well-being that the OECD work with. And that in turn is sourced from comprehensive wealth, which was those capital stocks. And you need to allow for substitutability between those. So sustainability is defined in that context by sustainability of well-being. Then what is the domain of public policy? Why is it the business of public policy to get engaged with that at all? The public domain is, in our framework, 5 dimensions. One is equity across society and generations. The other is resilience to major systemic risks. The third is sustainability. The fourth is social cohesion. And the basic idea here is to say that these are areas where individuals left to their own devices will underinvest. And so if we can, as a public policy framework, invest in these things and expand the well-being frontier, then people, it's like think of a playpen where kids live. Those are the domains of public policy. Those are the 5 dimensions. And if you expand them through public policy, then the space within which people live their lives is expanded without in any way having a judgment how they should be living their lives. So what do we do with that then? Well, we talk about an investment approach. The question is, what do we invest in, when and how, in order to get that impact? And we do a lot of modeling to show the interdependencies. So take the 11 domains of the OECD. How do they interact with each other? So if you invest in health, it improves leisure capability and productivity. If you improve productivity, economic growth expands, but then you damage the environment. So policy needs to be health as well as environmental interjections need to come in hand. So the policy is a policy package rather than a particular one or two policy levers. That's our investment approach. Where we focused right now, of course, is if you think of capabilities and opportunities, is basic income, housing, education, and health. Provide the platform of all the policies. So that's the focus of it. And in terms of the actual focus right now is investing in terms of the biggest bang for the buck in terms of that modeling is showing us if you invest in children between the ages of 0 to 14, which have 4 or 5 symptoms, then we know with a great probability they'll be in trouble in some years' time, and invest in them now rather than invest later and pay the price. Even if you take a pure fiscal view, you would do that. Of course, we take a much wider view. The final point I want to make in terms of Martine's points this morning, talking about measurement, analysis, advice, and implementation, I think we are okay in terms of where we want to invest and so on. So the policy, I think, is relatively clear. Where we're having major issues is in implementation, because our public sector, as yours probably, is comprised of silos. They cannot work together to deliver outcomes to the citizens. So our ministers thought, because we had the data, we knew all the poor people who we want to invest in. We actually, New Zealand is such a small village, we know exactly where they live, we even know their names. He assumed that because we know them, we can fix the problem. Where I said to him, you keep talking about institutions, well, our institutions are not set for the right purpose, so we need to really reconfigure how we deliver that. So that's the major challenge for New Zealand. And the way we are trying to address it is to emulate the UK, as far as we understand it, is we gave up on integrating these services at the center. We are trying to do it in the regions, bringing all these services together in the regions and incentivizing them to do that. Thank you.
Girol, thanks. Sorry, the 5 dimensions you talked about: equity, resilience, sustainability, cohesion. What was the last one?
Social cohesion.
Equity, resilience, sustainability. I think I'm missing one.
I'll think of it in a second.
Just one other before you think. Just one other. You said you don't make any judgments, because one of the interesting policy, I think, dilemmas in this area is around paternalism. So we do know that alcoholism and drug abuse are a really bad idea for well-being. How much extra effort should governments take, or does the New Zealand government take, to kind of stop people making mistakes?
Right. By the way, the 5th dimension is potential economic growth.
Potential economic
growth. Material well-being is
material
the 5th dimension. Sorry, I'm going senile. But that doesn't matter. In terms of at that point, that's a fantastic point. We agonize about that all the time. In other words, if you do everything you can to give people the opportunities and capabilities, and by the way, in the Aero framework, opportunities, capabilities are embedded in those capital stocks, which are comprehensive wealth. So their growth and allocation, distribution, is what drives opportunities and capabilities. Suppose you did everything you can and people still keep eating excess sugar. They have obesity and all that sort of thing. Do you still intervene and do nudging and all these kinds of things, or don't you? It has divided New Zealand. We don't have a view on that.
Okay.
It's one of the most contentious issues. It's,
okay.
Yeah.
Well, we can maybe pick it up and get... Mark.
Yes. Well, the question you gave us, how would policy change if well-being was the objective? And I don't think I can answer that on a general scale, so I have to narrow it down a bit. And I'm going to talk about health, because health is quite interesting, because in principle we've got quite a long way in health in getting people to think about well-being as the core problem. We have this concept of people-centred care, the idea that traditional healthcare just sees people as a collection of offal. Some of the bits of the offal go off a little bit and you have to treat them. But basically, what we should be doing is looking at people and whether we can actually make them feel that they are better off. It's difficult to exaggerate just how far we have to go to put this concept into practice. I mean, we've been talking about it for about 20 or so years. Many of you probably know the joke, which isn't funny, I should say immediately, about why you nail down coffins. You know, which, I mean, strange, really. The person inside probably doesn't care that much if you're nailing down the coffin. And, of course, the answer that the medical profession gives is that they have to do that to stop the oncologist getting in to give you another round of chemotherapy. And there's an element of truth in that. Just in the last 12 months, a couple of studies from the US, both of which are looking at different life-threatening, life-finishing cancers. These are incurable cancers, and people who are receiving some very intrusive, nasty chemotherapy with no chance of cure. You might extend their lives by a month or two with obviously lots of side effects. You know what they all are. One of the studies found that 69% of the people receiving this chemotherapy had no idea that they had a terminal disease. The other one found that 81% of the people had no idea they had a terminal disease. You can't help feeling that if you are actually treating people as people, that maybe you would want them to make that decision about how they finish their lives themselves, rather than making it for them. I can go on. Hip replacements, wonderful things, hip replacements, except that when we actually ask people whether they improve people's quality of life, about 25% of them don't. Another example, John from Canada, actually, and it's a little bit old and things have changed, but it's still quite striking. Of the people in old age homes who have dementia, they found in a survey that 1/3 of them were receiving antipsychotics. Antipsychotics do nothing for dementia. What they do is to make you basically switch off. That, you know, you're no longer functioning. You're much easier to deal with. You're the person who's sitting in the chair dribbling rather than actually screaming and shouting. That's certainly not in the interests of the person. And to be fair, in Canada, it did make a difference, and policies changed it. And that kind of brings us on to what I thought was the most striking thing in the book, which is that all these bar charts you find, the one which is going way out there, the biggest chart, is mental health, again and again and again. And I'm going to see if I can do a stats dump in the next 30 seconds of why mental health really does need to be the number one focus. 20% of people at a moment in time have mental health problems. 50% of the population will have mental health problems during their life. 75% of mental health problems appear before the age of 25 and potentially could be not avoided, but certainly managed better if they were identified then. The global burden of disease due to mental health is about 23% of the total disease burden, yet we only spend between 5% and 18% of health budgets on them. In employment, when we actually look at people who are receiving, of working age, who are receiving a benefit, 50% of them, on average, across a range of about 17 countries, had mental health problems. So mental health is this great failure. There we are proving in this book what an enormous impact it has on well-being, and yes, our policies are just failing enormously to deal with this problem. At all levels, childhood right the way through to old age. I just need to finish with one point, slightly subverting what I've been saying about, because I really, really hope that the wellbeing agenda will give us ways to actually implement better policies in the health and mental health areas. The only catch is that all the examples I've given are stupid, even if you take a narrow GDP-based version of the problem. I mean, why are you pumping noxious chemicals into somebody when they don't necessarily want it? Why are you doing hip replacements when they don't need it? The rate of return to investing in mental health, as Professor Layard has shown many times, is enormous. So we don't need well-being there. I think well-being might help us, but it's a lot more than measuring correctly that we'll need if we're actually going to change policy and move the dial. Thank you.
Mark, thank you very much. And Mark, have you got, I mean, one of the reasons doctors give chemo to dying patients sometimes is to give them hope. And so it's often that is an implicit welfare judgment by the doctor. In fact, if you talk to oncologists, they'll sometimes say they make a judgment about whether the patient can take the news, or whether giving them hope is going to give them more quality of life. I just wonder whether actually maybe some of these things are just embedded in behaviour in ways that economists don't understand, but the real practitioners do kind of know. They do know that there are some patients who say, look, this isn't going to work, should we give up here? And others who you don't want to have that conversation with. Is that fair?
Isn't that where you use the placebo?
Well, exactly. There are other options.
Well, doctors are there are all sorts of medical oaths that they take that worry them about using placebos. But you're right. I mean, that would be the obvious outcome. Go on, Mark. Quick comment on that.
But not about the oaths don't prevent them from implicitly deceiving, at the very least, the person that they're treating. I mean, I would question. I suspect you're right that is the reason. I'm sure you're right that is the reason. I think ethically, morally, and indeed medically, it's an extremely dubious practice for the physician to take that on themselves, rather than to ask the patient to make those sorts of decisions. You are talking, I mean, it's an extreme example, the ones I'm using from the US, and I certainly don't want to imply that all oncologists are just ramming drugs into people. Nevertheless, I mean, the idea that somehow the last few months of somebody's life should be spent vomiting in extreme pain, with hair falling out, with no dignity, as opposed to the person choosing how they are actually going to die, I think is really quite difficult to say this is something to do with hope. If that's hope, I don't want anything to do with it.
Good answer. Okay, let's hear from John. John.
It's been alleged that, in fact, I alleged it myself, that if the well-being agenda and research were taken seriously, every department of government would do things very differently. They would have different objectives and they would approach them differently, and both are critically important. Part of the reason, well, the number one reason is almost every government department, almost every activity is set about finding out what's wrong and trying to fix it. We've heard it all through today's discussions. You hear it everywhere. And that's exactly wrong from a well-being agenda. So first of all, you have to provide the professionals with the data that would enable them to do something other than spending their whole time finding out things that have gone wrong and trying to put them right, and give them the chance to create good things and know whether they were doing so. Think of the typical GP's route. It has a whole long depression inventory. It has no corresponding inventory of positive mental states, even though the latter are more predictive of future health than the former. They have no questions about life satisfaction. There is a fully developed by Diener and others set of positive mental outcomes, thriving outcomes that are all ready to go into GP practice. Who are the people who are getting those out into clinical practice? So we scientists can come along and say, yes, if you follow these patients with these things, you find out that it was the positive that was more important than the absence of the negative. So the science is there to suggest the whole measurement pattern should be different, and the objective pattern ought to be different to create something good, just not to repair something bad. And of course, it's very different when you do that. The focus, Mark quite rightly made on healthcare. Let me quote two things from Atul Gawande, who's, of course, a first-class doctor, and you may be referring to him yourself, but two tiny squibs of that are worth reporting. One is, you know, they had this big study of WHO guidelines for how you handle things in the operating room to avoid bad events. It turns out that they've cut bad events by about 50% with these guidelines. They thought it was all to do with like double checking before you take off in an airplane. It turns out when they finally dug in, the number one thing that was happening because, and at that stage, and only if this part of it were there, that everyone around the table drew down their masks and introduced themselves to each other, and they discussed what they were going to do. They call it the timeout. What that timeout did is what every piece of well-being research would tell you. When you get people to connect personally with each other, you flatten the power structure, you give people the competence and the capacities to become teammates and partners, and they cut all these bad things happening, but that's only a tiny part of it. All of those people go home energized and more productive and better for the next time. The second one is his subsequent book, Being Mortal, where he actually goes through the treatments for people in end of life, and he's simply shocked about it. And that drags me into the first care example I want to give you, which is in healthcare, because essentially what Being Mortal was all about is a revolution in the handling of the delivery of all services to those in the final 20 years of their lives. Now, a lot of that is informal elder care. And formal elder care, not just hospices, but formal elder care is just terribly badly handled. And he has marvelous stories of how it can be done right to create happy lives for these people. And you can give them hope and you can give them pleasure. There's no question about it. I visited the care home, the Lotte Care Home in Denmark that was doing these things. You go walk into it and you can just see it's a home, it's not an institution. And there are pictures on the walls and candles on the table, and they go on holidays together. Back to Richard's point about doing the cost-benefit analysis in terms of life satisfaction gain per pound, I went to her and I said, this is wonderful. Do you get any budget for this? She said, oh, no, we don't get any more budget than any other home. She said, it doesn't cost anything to smile. A hug doesn't cost anything. Treating people like people rather than like someone you're giving a service for. And I said, well, why isn't everyone else doing this? It's so painfully obvious from the research that this should be happening. And these are final care Alzheimer's patients. They live 5 years longer and patently happier during that process. They've created huge numbers of happiness years for no budget at all. I said, why don't people do it? He said, it's fear. It's fear because you're giving people freedom to do things for others. Remember, it's not just the freedom to do things for yourself. It's having a purpose. It's what Jeff was talking about this morning. It's having a purpose. It's allowing people to open doors and help each other to create better lives. That's what keeps them alive. It's what gets them up in the morning. It's what makes them happy. Well, it doesn't cost anything, right? You're now bringing in people who otherwise were being given things and parked in chairs. You're giving them a chance to open doors and do things for other people. And it's fear, because what goes wrong? We'll be sued, we'll be this, we'll be that. And the whole climate of fear that's destroyed the corporate life in almost any organization you can think of by having risk committees and reports is making it very hard for people to do better than they can, but it can be done. Now, in 4 minutes, I've used at least
Use
two.
your 4 minutes, but just give us the second policy.
The second one I got into from a meeting that David Halpern and I were in Ottawa, where 6 countries were invited to bring on a starring event from their country about making lives better through better government in the next centuries, going back more than 10 years. And the one that blew my socks off, if that's the right metaphor, is the one from Singapore, which is about the reforms in the Singapore prison system. We're now back as far as 1998. Now, they weren't driven by well-being research or well-being numbers, but they implemented precisely what we know from the clinical and other well-being research. They got together, they said, we are fighting with each other, prisoners and guards, and the community was everybody's unhappy. And so they sat down and rethought their purpose. Our purpose is to build better lives. That's now on the New Zealand Treasury masthead, so it must be okay. And so what did they do? They ended up with a system that was completely different. So from an awful place to work, it's the best place to work in the public service. From the recidivism rate has dropped by 1/3. The people coming out don't come back as prisoners. They come back as volunteers to help people there. The education process is going both ways between guards and prisoners and so on. It's very evident to be done. So when I talk to justice people and so on nowadays, of course, I was driven to do this, to make this contact by the inspiration from Singapore. And so I picked up other examples of where it can be done. And remember what they had to do. They had to change their objectives, and they had to change how they did them. And it wasn't that hard, of course, to get absolutely first-class service. Yes, they were more productive and they were cheaper, but that wasn't the point. The point was to build better lives. So here's an example. There's a so-called hub model they've applied in Prince Albert, Saskatchewan. It's been applied in a native reserve as well. It's a very simple idea. That yes, they can now find very trivially the people who are getting in trouble. And the first point of call was the police being called in, and they're called in for a domestic dispute where somebody gets shot and injured. He said that can't be the right way to handle issues like this. So the hub is bringing together people from all the relevant agencies in that geographic confine, people in delivery of social services, delivery of health services, all the things you can think of people who one way and another act in a way that affect the lives of these communities. And they break down the silos. That was one of the problems, right? They break down the silos, they change their methods, and I'm shutting up.
No, John, that's but you've given us some real food for thought. And John, I just want to come back. Take that hub one, or take the prison reform in Singapore. How do you answer the point that Mark modestly made about his own suggestions, which is subjective well-being isn't really giving you much new insight in here? This would be a good idea, whatever your policy framework, whatever your your view of these things. If you're a cost minimizer, tax cutter, whatever you are, you would do what the Singapore jails have done, or what the hub has done, wouldn't you?
The justice people I talk to in Canada find this enormously empowering because it changes, and it's also happening in a slightly different way in the healthcare area. They are not about stopping crime. They are not about catching criminals. They're about improving the lives of everybody in the community. And it sort of changes the way people relate to each other. And yes, it does cut crime. But if you think of it as crime fighting is the objective, that's not going to get the overall gains. And so they are repurposing themselves, rethinking themselves as people who are helping to create better lives. It's a hell of a lot more fun, and they tell us this. It's a hell of a lot more fun right. to build a better community than it is to catch a criminal.
I want to open up to the floor in a minute. I just want to give David a chance. David, because you gave us some sort of quite interesting examples, what will be your favourite example? Because we've now had quite a few specific policies, and I want to give you a chance to mention a specific one. What would be your kind of favourite policy that well-being framework gives you that would probably not come out of something else or wouldn't naturally fall out of another?
Well, I think some of the ones which are touched on, which is to reveal these other, essentially human aspects of what matter in public service is pretty powerful. I remember years ago, someone was running the prisons actually saying, and it struck in my mind always, so there's 1,000 different ways of shutting a prison cell door, right? And you kind of know what he means by that, the attitude with which you do it. That's not normally captured in a lot of our, that's not normally captured, the way in which you shut a prison cell door, or these issues about the way you treat, a patient. So know my name, the know my name kind of movement, right? You should know the patient's name. These matter just enormously to kind of humans. If I had to choose one area, though, I think it is probably to do with the social. Humans are phenomenally social beings. Actually, we have it within ourselves to be quite nasty and conflictual beings too. And that this matters much more than is generally being accounted for, I think, in most policy and certainly economic models. So volunteering actually for me is just a beginning of a much deeper new look at the way you design public service or even economies. Not just about volunteering, but forms of reciprocity. So we don't ask in public services like, hey, we've really helped you do this thing. Would you be prepared to help someone else? This is a much better way of doing things on a whole number of dimensions. It's potentially quite transformative, and that people underestimate systematically how nice it is to help other people. So I'd have that pretty well
that's a good
there.
one. Volunteering should be compulsory. It's obviously a good thing. And I can actually give you, there is a problem about all of that particular one, which I tried at Radio 4 to sort of as a Christmas thing, to get Radio 4 to organise a kind of volunteering appeal for elderly people to look after other elderly people. It was a year in which there had been a lot of cases of social care had been rushed in, 15-minute kind of, they just basically throw the food at the poor bed-bound, homebound patient client, and then run out for the next job. And so the idea was to just have much more kind of volunteering between young elderly people for older elderly people. And the conversation you get into when you start it immediately is you can't have anyone going into someone else's house without a criminal record check. And so that just ends the whole thing there. And then plus all the other kind of difficulties and the liabilities and, you know, who's going to organise it. It was a sort of complete nightmare. Right, look, I want to open up to the floor. Let's take some questions on principles or specifics. We'll take the lady here. I'm going to give priorities to women because we are all-male panel. So
Can I just say, when asking your questions, please talk into the top of the microphone so we can hear you clearly.
Talking to the top. Yeah.
Like this. Oh, good.
Can you stand up and tell us who you are as well?
Yep. I'm Sarah Stewart-Brown. I just wanted to tackle this issue of the focus on the positive, because we've had it from several panel members and you're not convinced. And I just need you to know that we started off with the quote from the Buddha about your mindset. It changes something. The positive psychologists have got masses of research showing that if you help people focus on the positive, like 5 good things that happened to me today every night before you go to sleep, something happens to your health and your well-being. We know it in appraisal systems, and good management is about telling, first of all, what people are doing well and encouraging the positive. And it's not, I mean, David's saying it's all respectful and dignity, and that's a good thing. Or patient-centered care. I'm not denying that, but it has an effect on your autonomic nervous system. It changes the way your physiology works. So it's going to have an enormous impact on your health in the longer term. And it definitely does. So just using a positive measure, just focusing a whole conversation in a general practitioner's surgery about what's going right, changes the nature of the dialogue and changes something fundamental about the health.
Right, thanks. That wasn't aimed at me when saying I'm no, I'm not sceptical. Don't say. I'm not. Sorry, I really am not. Look, I have no opinions. I work for the BBC, but no, I'm not a skeptic. I'm just asking the questions. I really am. Over here, please.
I'm Paul Flower. I had a couple of observations to make from the point of view of a clinician. I'm actually an economist who went into medicine because I lost faith in economics. and I'm very interested to hear Mark Pearson's comments in particular regarding I suppose the point being the motivation of doctors. Because I think the problem for management and making any resource allocation decisions in healthcare is that at the end of the day, the good clinician, in quotes, if such a person exists, is somebody who understands what the patient is trying to communicate when the patient themselves doesn't know. Now, I think the work that's been presented today is fascinating, absolutely fascinating, and tremendously important. But the one thing is that it's all kind of premised upon is the idea that people know what they think and what they feel. And the reality is they don't. And I think I can say this as a clinical psychiatrist, that they don't know what they think, what they feel very, very often. And that this makes the whole edifice of this kind of analytical work that's been presented, I think, a bit shaky. I mean, it's not that it's not worthless, I think it's vitally important. But we have to remember that looking at mental health, the first attempts to deal with mental health were socially oriented. They were the creation of asylums that kept people out of sight. The fact that they may have also had a possible side benefit on giving people some sense of value, some sense of understanding, of recognition, a sense of community with each other. I started my training in a former asylum, which had been a self-sufficient community at one time. It had been changed into a hospital.
But I think we've got the point, and it's a very
yes,
interesting one. Who would like to take it? Mark, go on, because it is a very interesting one. Maybe.
Yeah, and I think you have to separate out, first of all, the obvious point. I mean, we're not talking about the diagnosis here. We are talking about the patient being involved in the decisions that affect them. And what we have found in area after area, I could go through childbirth, many others, is that if you involve, at the moment, the way the medical structure is set up, you end up with an overly medicalised response. Hence, we end up with more hip replacements than we potentially need. We end up with more drugs being pumped into people than that is probably good for them. And you could go on. So it is partly about who's making the decisions. Now, that said, where I do have some sympathy with what you're saying is, can we really always expect people to make the decisions that are in their own best interests, even as they see it. And I think we get this from another area. I was very, very interested in a policy experiment. I don't know if anybody's here from the Netherlands, but your old lifetime accounts. So they had accounts where you could save up time over your life and decide how you were going to use them. The idea was that you would take a year out so that you could reskill yourself, so you could change careers. Sounds like a wonderful idea. However, it also said that if you didn't use these accounts, then you could use it to retire a bit earlier. And what they found was that basically everybody used it to retire early. And nobody was using it for the purpose that it had been really developed. And I think this matters because what we know is that people systematically are myopic, that they actually overestimate the incomes and the standard of living that they're going to have once they retire. And so by retiring early, they were making themselves worse off. And we can see this, obviously, in the literature, that people constantly overestimate this. Now, I'm raising that as a problem with people being involved in making their own decisions, and obviously we can try and solve it by giving them much more information. I suspect the only answer there actually is this is a case where a little bit of paternalism is probably a good thing. And we probably do need to stop people retiring excessively early, even though we know that if you give them the opportunity to do this, they tend to retire incredibly early. I'm tempted to refer to the French case at this point, but I will resist.
Well, look, I think this is a really, really interesting one, this sort of issue as to how far you have to prejudge, because you know what makes, you have the evidence of what makes people subjectively well off. You don't know it for each individual, but you know it on average, and you can see where there are regrets and mistakes made, and how far should the state intervene to correct those mistakes. Girol made the point that that in New Zealand is a very hot issue and a divisive one. John, can I ask what your take on it is?
We're miles from there. In case you didn't hear me, I said we were miles from there. Well, the whole point is there are so many places where it's obvious where things could be changed in dramatic ways that would improve things for the people providing the service, the people receiving the service, by their own judgment, by peer judgments, by everybody's judgment, that let's get on with it. And there will be some places where we say these are ones where they're potentially winners and losers or people misjudging the goals, but they're never going to be more than a small fraction, and it's very easy to choose your starting point so as to make them non-issues. I'd say get on with it and get to a place where we've at least made some of the obvious gains before we look for the possible problems that might arise with mistaken applications. To me, it's just an echo of the fear that says don't do anything because something may turn out badly. Well, that leads us into, keeps us in a situation where things are much less good than they could be, and we've got no real excuse for that.
David, quick one on paternalism, and then I'm going to take another question.
Yeah, well, I said you can go a long way, I think. Just in some of those options aren't even available. So end-of-life care is a good example. Most people die in hospitals. They don't want to die in hospitals. The system fails, in fact, to express even the existing preference, let alone a more informed preference. And in some areas, by the way, we're okay about paternalism. And Rich has often made the point about kids. Actually, we're really paternalist about it. So why don't we try and help kids learn a set of habits to savour and enjoy a life, as well as learning a bit of maths and English along the way.
Okay.
I'm right, mate.
We'll take another question over there.
Jenny Edwards, Mental Health Foundation. I've been very struck since working in the mental health arena how many people who have the least life satisfaction and the most at the margins say that most of the things that make them feel really bad are their interactions with public services, particularly DWP, the way they're treated with very poor respect. They feel it's deliberate, which I don't think it is. But the other side of that is how many people I meet providing public services who are good people, who want to treat people with respect and feel that when they have the chance to, they're almost rebels within their own organisation. The people who've got 15 minutes to help somebody get up in the morning and find they're still on the toilet and their boss is telling them to leave them there, they've got to move on. Why is that like that, and what can we change in terms of, what policy changes are there that are within the power of government to do, because we are all as taxpayers paying for a system that feels like that if you're receiving it or providing it.
Girol, you've been in a treasury. You're not there anymore, but you've been in a treasury. Give us the answer to that.
This is a very live issue. We went all around the country in a context called Tackling Poverty, visited 9 regions and talked to many, many people. And unanimous view that people want a one-stop shop. They want to go to one place, like a general practitioner's office, and somebody starts looking after them as a whole. And they don't get it. So a very little town in New Zealand called Manawatu, where I was, has 83 agencies that are all doing good, so they say, but the public wants them to be integrated. And then we explored it, and the reason is very obvious. The incentive mechanism is wrong. They all are worried that if they were to work together, they would lose their source of funding, and therefore they don't. So the role of the center in that context is to remove that obstacle and put the right incentive structure and say, if you work together and deliver these outcomes, then we will keep funding you, otherwise we'll withdraw it. So that's one idea.
I'm going to, we'll take a question here, and then I'm going to ask one. Go ahead.
Thank you. Following up, Anna Alexandrova, Cambridge University. How do we stop well-being from becoming another indicator that is gamed? Because if there is one thing we know is that whenever a target is introduced into public policy via benchmarking, say, it becomes gamed, it undermines public policy. How do we stop well-being from falling into the same trap?
So this is Goodhart's law. If you really take these things seriously, then the relationship to the real outcomes might change. Who would like to answer that one? David.
Thanks. Well, one thing is you try and avoid attaching obvious fiscal incentives to it. Is a pretty good way around it. I mean, you do see evidence. You'll see gaming, for example, in the friends and family test is, well, you see areas, let's make sure that we ask the people who we think had a good time this question, and other ones we don't try so hard. So there will be those risks, but I think still, you can put other kinds of measures to try and make sure you've got a degree of randomization in the test or whatever. You can also use a point which was made earlier in a more strategic way, which is that you kind of use Richard's types of regressions to work out what are the primary drivers and have you got the weights correctly. And this might take you to different kinds of solutions in a strategic way. So, and it can go to pretty big marginal decisions. You decide high-speed train, if you worked out the valuations differently and you value the time, one of Gus's favorite examples, would you end up with a different decision about actually have more capacity, slightly slower trains, but we'll all be happy talking to each other, and that will be a better solution. So, I mean, yeah.
Mark?
Well, it's not a full answer, but it's a partial answer that I'll give, which is, at least in the health area, I think we can mix up the questions about people's experiences and well-being with what are generally considered to be the hard measures. So, for example, next month we have a big health ministerial meeting at the OECD, and one of the things that we already know that ministers will be mandating us to do is to develop a series of patient-reported outcome measures. And these will be measures, so you basically say before and after an intervention, or looking at somebody with a particular chronic disease, looking at how they actually are feeling themselves about the health care that they've been given, but also how they're actually acting, how they're actually behaving. Can they do things that they weren't able to do before, or are they seeing a decline in their activities that they can perform? But we can combine that with other measures at the same time in the way that we collect it. So we can actually do tests in some cases, so you can actually measure, are people being able to walk this far? We can do tests to ask with the physicians that they're involved about what was the nature of the treatment that they've received. By combining the two, I think you can actually find a way to actually control for possible gaming, but also actually build confidence in the more subjective, which I don't really believe is subjective, because I think it is the objective of, certainly of healthcare, but probably policy more generally, of improving well-being. But you have some harder measures to go along with the softer measures. Obviously, that's a long-term program that we would expect at least 5 years before we even get pilots of internationally comparable data being developed through this. But still, I think that's one of the possible answers.
Before we move on, I don't want this just to be a public sector management session, because I think there are some big issues that come out of the book. And I want to just try this one out, which is about progressive taxation. I mean, the most stark-staringly interesting proposition is if you believe subjective well-being is a suitable framework, there is diminishing marginal utility from money, that the poor value it more than the rich. I mean, this is not particularly difficult intuition. And you are driven to saying an appropriate policy intervention is to take money from the rich and give it to the poor. Can I just ask how many of you here, from the literature, as opposed to from your general prejudices, from the literature, how many of you here agree that is a conclusion that can be drawn about a policy measure that a society should adopt to improve subjective well-being? How many of you don't think more progressive taxation is? Do you want to tell us why, sir? I'd be fascinated to know. Yeah, no, this is in the spirit of inquiry. I mean, I'd be very interested to know.
I wish I could believe it. I actually, when I first read that proposition in Richard Laird's earlier book, I loved it. I thought, yeah. And then I looked around at the evidence, and the evidence to support it just wasn't there. Actually, I'm in favour of progressive taxation, but I don't think that the numbers back it up at all.
Right. Can I ask another question of you? How many of you in this room, for reasons unrelated to subjective well-being and the literature and the book that Richard, how many of you believe in more progressive taxation?
More than what?
So we've got one more vote the second time than the first time. Why are we not discussing that? I mean, we're discussing, health doctor behaviour, and we're discussing prisons. Why are we not discussing, in a policy forum, why are we not discussing progressive taxation with the same prominence? Because it does stick out, really, doesn't it? That's where the literature takes you. Go on, John.
Let me agree with Neil on this one. The problem is the literature really thinks people get a lot out of things they do voluntarily for other people. They do not get a lot out of somebody taking something without their approval from them and doing something else with it. If they are invested with psychologically invested with the choice of the recipients, the method in which it's done, they will give money up the gazoo in order to take part. So to not channel those much more psychologically and sociologically beneficial ways and just fall back into the old-fashioned Robin Hood stuff is maybe even a misuse of the literature, but certainly the literature hasn't filled that to say that of all the ways of getting more resources, and these are deep resources, not financial resources, because we overstate enormously the power of dollars or pounds to fix these problems. That's not where the problems are coming from. As Richard says, when we do his cost-benefit analysis, most of the best things will be free. So you don't need more progressive, you don't need any more taxation.
Except that one does seem to work, and we can just pull a lever and make it happen.
Well, that's the whole point. They choose, people immediately fall back on a policy that's got their name on it and something they can do. We haven't filled that big gap between where the research is and where it should be to see what tax structure might come out that would do a better job, but it's certainly, in any event, going to be subservient to the redesign of the mechanisms whereby the services are designed and delivered.
Mark, I think you wanted to say.
Well, I'm just not convinced that your prior is right. I mean, there is a huge amount of interest in how the 1% are being taxed. There's a huge amount of interest in closing down tax havens. Now, it's not coming with the well-being literature, but clearly there is some feeling of fairness that's going on there, which is the proxy for well-being. So I think probably your prior isn't right. I think it is there in the debates. It's just not being expressed quite in the terms that we're using today. But that's coming back to the original question that you basically said. It's much easier to point a camera at Panama than it is to point a camera at well-being.
And it turns out there is a psychological literature on tax-paying norms. In fact, people who think it would never cheat on taxes are happier than those who wouldn't. Those countries where people want to pay taxes and say, I'd like to pay taxes more in order to produce things, are happier countries than the reverse. There isn't as though we haven't got some way along in that direction.
Lady down here, wait for the mic.
Okay, I will be a little bit provocative here.
Stand up.
Okay, I should stand. Sorry.
And you are?
About taxes.
Tell us who you are.
Daniel Andren, Sweden. Okay, your question was about rich people paying taxes. What we know, rich people avoid to pay taxes. And Milton Friedman has something about this. But in the context what we hear today, when Hillary Clinton, in the debate, tell Trump that he don't pay taxes, he said, because I'm smart. And here I think that it's an approach. And I get your points. And I'm coming from a country where people pay taxes, and it is a social norm, very respected. I think that rich people not paying taxes and avoiding paying taxes, I think that it's a problem.
Yeah. Okay, no, that's very fair. We're going to take, I'm going to take 2 or 3 comments, and then we'll wrap up. We'll take the gentleman right at the back there, and then the lady here, 4 rows down.
James Oswald, University of Sheffield. I wondered whether one of the implications of the wellbeing literature is to pay less attention to reducing inflation relative to unemployment, and also to reducing economic instability as opposed to long-term growth. Because we know that big falls in economic output are really bad for well-being.
Falls are much worse than rises are good, if you like. Yeah. Let's hold that thought, and we'll take, just down here we've got another last one. Yep, go ahead.
Hi, Julia Ferrari, LSHTM. I just would like to put a question to the panel regarding taxes and whether we are not again facing a question of misaligned incentives and governments trading off the power that these people that are or organizations that are extremely wealthy versus a redistribution of well-being at the societal level when they make the decision.
Okay, is part of the problem here that the literature is kind of quite sophisticated, but it's not really calibrated enough. I mean, we don't have enough well-being literature over 200 years to tell us how inflation up and down affects people's subjective well-being. I mean, I wonder whether that's it. That's my sort of initial instinct. And then you might start worrying about, well, if you might just go straight back to the old discussion about should we allow higher inflation, because higher inflation then creeps up a bit, or you have to have a recession to get it back down again, which is I just wonder whether subjective well-being is going to be interesting there. But look, I'm just going to let panel comments on either or both of those last 2 questions.
On the misery ratio, the literature is hard to pin down because, of course, it's macro, so you're short of observations. But by and large, a sort of 2-to-1 misery ratio is what the international evidence would say, which means that unemployment counts more than inflation.
Unemployment counts more than inflation, yeah. David.
Yeah, I mean, I would talk broadly exactly as we just heard on that. And other points we didn't quite get back to earlier, like on DWP, etc. I mean, I think that's a good example of, look, it can take you some of these bigger issues, like on the tax and whatever. You have to then build, of course, a fuller structural model. If you can drive up the living wage a certain amount, what's the point at which you're going to start having unemployment will be a key issue you want to factor in. But in terms of compressing at the top end, you certainly might want to do that, and certainly conspicuous consumption. But in the meantime, you can certainly get on this absolutely massive array of things which matter hugely to people about, do you know their name? Do you treat them with respect? In New Zealand, there was an example driven actually by security concerns not very long ago, where people were then kind of met at the door, asked what the name is, what the issue is, taken. Now, in fact, it was being driven by security, but people really liked it. Actually being taught by like a human being, actually, because we're afraid, you might do something terrible. But that really matters enormously. And it's just being systematically undervalued. And it's rather like the smile, that just matters enormously. Or cracking your problem about surely we can work our way through that. We can design services and ways of running a society where we can reciprocate and help each other and bring out the best in human nature as opposed to the worst. And we should damn well, figure that out.
Yeah. Girol.
These issues about inflation and so on in our framework is captured by two of the dimensions of public policy. One is systemic resilience, the other is potential economic growth. And on both counts, a low and stable inflation does, and financial stability affect the playpen, as it were, the well-being frontier, by making a more resilient economy and society, as well as increasing potential economic growth. That's how we approach it, rather than going to the micro level. So that's why building the right institutions, macro, financial, fiscal, and so on, which give you that resilience, is extremely critical in the way we think about the role of broader public policy.
Which is the answer you first thought of before, isn't it? I mean, that's where you would have been in 1980, 1990, Mark.
Well, I have nothing to add on the inflation and employment points, the points that have already been made. I suppose just on the general macro point, the one thing I would say is that I think we do know, again, from this well-being literature, just how much people care, not just about their own well-being, but about the prospects for their children. And maybe building in a little bit more of a consideration about what the consequences of policies are, or the developments are for children, might help explain some of these big macro trends that we've been seeing in well-being, that people are now much more worried about the future prospects of their children. And so it's not just about their own point estimate of well-being, it's about where they see the world going. And I think that maybe is something that we need to build into our discussions a bit more.
It is time to end this session. Actually, to me, the conversation sounds absolutely fantastically interesting, and I hope I don't come across as too sceptical about it, because I think in some ways it does sound still quite early on in its life, and a lot of it takes you to where you would have been anyway. A lot of it maybe gives you very fresh insights. A lot of it is kind of quite random experiments that have yielded very interesting results. It reminds me a bit of Reinventing Government. I don't know even what happened to that. There was a book called Reinventing Government about 20 years ago, where suddenly a whole lot of kind of fresh thoughts and ideas came out of a slightly new way of thinking about public sector management. And a lot of our conversation has reminded me of that. But I do think there are bigger issues about the shape of society and tax and pensions and old age and intergenerational equity that maybe also come out of this. But we would never get to do justice to all of it in 70 minutes. But look, I think it's been a great session. Can we just thank our very informative panel? Thank you.